Welcome to UMCC Medical Consultant Connectors, where your health matters to us. A disrupted connection understanding hip dislocation. The hip joint is one of the largest and most important joints in the human body. It is a ball and socket joint that provides a wide range of motion, allowing us to perform various activities with ease. It allows us to walk, run, and move our legs freely. This joint plays a crucial role in our daily lives, enabling us to engage in physical activities and maintain an active lifestyle. A hip dislocation occurs when the head of the femur, or thigh bone, is forced out of the acetabulum, the hip socket. This displacement can cause severe pain and immobility, making it difficult to perform even simple movements. This can happen due to a variety of reasons, but the most common cause is a high-impact injury. Such injuries often result from car accidents, sports injuries, or falls from significant heights. Hip dislocations are serious injuries that require immediate medical attention. Prompt treatment is essential to reduce the risk of complications and to ensure proper healing. If you think you or someone you know has dislocated their hip, it is important to seek medical help right away. Delaying treatment can lead to further damage and prolonged recovery time. Early diagnosis and treatment are crucial for preventing long-term complications, such as arthritis. Medical professionals will typically use imaging techniques like X-rays or MRIs to assess the extent of the dislocation and plan the appropriate course of action. In this essay, we will delve deeper into the causes, symptoms, diagnosis, and treatment of hip dislocation. Understanding these factors can help individuals recognize the signs of a dislocation and seek timely medical intervention. Understanding these aspects can help us take the necessary precautions and seek timely medical care when needed. By being informed, we can better protect ourselves and our loved ones from the serious consequences of hip dislocations. When force overcomes stability, the causes of hip dislocation. Hip dislocations typically occur due to a significant force applied to the hip joint, often during traumatic events. The hip joint, being a ball and socket joint, is designed for stability and a wide range of motion. However, when an external force exceeds the joint's capacity to remain stable, dislocation can occur. These incidents can include motor vehicle accidents, where the impact from a car crash can generate enough force to dislocate the hip, especially in high-speed collisions. The sudden deceleration and impact can push the femoral head out of the acetabulum, leading to a dislocation. Falls from heights can also cause this injury, as landing on the hip after falling from a significant height can drive the femoral head out of the socket. The impact of the fall, especially if the person lands directly on their hip, can be sufficient to overcome the joint's stability. Sports injuries are another common cause, particularly in contact sports like football and hockey, as well as activities involving high-impact landings such as gymnastics and skiing. In these sports, the combination of physical contact, sudden movements, and high-impact landings can place excessive stress on the hip joint, leading to dislocation. While less common, certain underlying conditions can make individuals more susceptible to hip dislocations. These conditions can weaken the structures that support the hip joint, making it easier for the femoral head to slip out of the socket. These factors include hip dysplasia, a congenital condition where the hip socket is shallow, increasing the risk of dislocation. In infants and young children, this condition can be particularly concerning as it can affect the development of the hip joint. Additionally, a history of previous hip injuries, such as dislocations or fractures, can weaken the joint, making it more prone to redislocation. Scar tissue and damage to the ligaments and muscles around the hip can reduce the joint's stability, increasing the likelihood of future dislocations. Understanding these causes is crucial for both prevention and effective treatment of hip dislocations. Recognizing the signs, symptoms of a dislocated hip. Understanding the symptoms of a dislocated hip is crucial for timely and effective treatment. A dislocated hip presents a distinct set of symptoms, often making it a clinically obvious injury. This condition typically results from significant trauma, such as a car accident or a severe fall. These signs include intense pain, particularly severe in the hip, groin, or upper thigh. The pain can be so excruciating that it immobilizes the patient, making any movement extremely difficult. The affected leg may be difficult or even impossible to move, especially when trying to rotate it outwards. This immobility is a key indicator of a dislocated hip and should not be ignored. There may be a visible deformity, with the dislocated hip appearing shorter or rotated inward compared to the uninjured leg. This deformity is often noticeable to both the patient and medical professionals. Significant swelling and bruising around the hip and upper thigh are also common after a dislocation. The swelling can be extensive, and the bruising may spread over a large area, indicating internal bleeding. It is crucial to remember that experiencing these symptoms necessitates immediate medical attention. Prompt treatment can prevent further complications and aid in a quicker recovery. Attempting to move or pop the hip back into place can cause further damage. Only trained medical professionals should handle such injuries to ensure proper care and avoid additional harm. UMCC, your ultimate medical consultant connector.